The meniscus is a fibrocartilaginous structure in your knee. It actually acts to distribute force across the knee. It is involved in nutrition of the knee. It's got many functions that we likely don't even recognize, but the meniscus is a material that distributes force and actually creates some level of stability in the knee. In younger people, a meniscus tear is typically an acute event or a traumatic event, a loading situation where you plant your foot on the ground and twist on your knee is typically one of the ways that you can tear your meniscus. Hyperflexion, so I've taken care of kids in the past who've torn their meniscus wrestling when their knee is deeply bent and under force. That's certainly a way that a meniscus can tear. In older patients though, it doesn't take that kind of force to tear the meniscus. The meniscus is not well vascularized, so it doesn't really have a capacity to heal itself, at least not one that we recognize. So I tell people in my age group that if your meniscus tears, it's an accumulation of events. It's a lifetime of stress, and that can come in the form of, oh, I bent down to get a can of soup out of a kitchen drawer, or I was working in my garden yesterday and I had my knee bent all day and now my knee hurts. So those are the types of mechanisms that we see, typically in younger people more traumatic, in an older person less traumatic. In a younger person, I think every effort is made to try and repair the meniscus. We do think that maintaining meniscal material helps decrease younger patients' risk of developing arthritis. So I would say most meniscus tears in young people are repaired. As you get older, the meniscus becomes a little bit more, let's say, aged in itself. So again, it doesn't really maintain the level of vigor that you would expect a material to maintain as you get older. So it tends to get beat up a little bit. I give the analogy that if you've got a magazine material that's very tough and thick paged, it's very tough to tear that magazine, but as time goes on, if you were to crinkle that magazine up 1,000 times and then attempt to tear it, it becomes much easier. So in older people, the material just doesn't hold suture. It doesn't have the capacity to heal. So as you get older, the preference would be actually to remove the meniscal material when it's torn and symptomatic, and maintain as much normal meniscal material as possible to help distribute force throughout the life of the patient. So in a repair, typically what we do is use an arthroscopic technique that allows us to suture the sides of the torn pieces together. The meniscus in a younger person does have a blood supply, but as you get peripherally out towards the edge of the meniscus, the blood supply is more robust. So attempts are made to actually maintain that level of bleeding or create some bleeding in the torn area, and then place sutures across that area with the hope that the bleeding in that area can provide immature cells that ultimately mature into fibroblasts and cells and tissue that actually allows the two sides to heal back together. So in a younger person, a meniscus tear takes a while to heal because we are looking for the sides to heal together. So there's a period of time where we limit activity, there's a period of time where we limit range of motion, and then slowly but progressively introduce more activity. In an older person that has a meniscectomy, that's where we just resect the torn tissue. The recovery is much quicker. So we would typically say that someone has a surgery, let's say on a Monday or a Tuesday, return to work is a day or two after the surgery in most instances. Obviously that depends on the job, but usually people are feeling pretty well 2 to 3 weeks after the procedure. Again, in that setting, we're not asking for the meniscal material to heal back together. We've resected the torn pieces, and there really we're just looking for the skin to heal after we've made an incision to do the surgery.